Ebolavirus wreaked havoc in the world not too long ago, yet it seems prehistoric due to the emergence of COVID-19. Today, I will be providing a fictional case study of a doctor who visited a foreign country and came back with one of the deadliest viruses of the 21st century. I will discuss the Ebola virus, how it is transmitted, how it is diagnosed, what the symptoms are, and finally, how it can be treated. Dr. Woodruff has been a member of the Doctors Without Borders organization for nearly 5 years. On his most recent return to the United States from Zaire, he observed symptoms that worried him deeply. He was experiencing a high fever, muscle aches, and fatigue. These symptoms he knew were a serious problem because a week before he left for the United States, he was caring for a sickly patient when the patient abruptly sneezed on an exposed surface of his body. Thinking nothing of it, he did not take the proper precautions to sanitize the area. Proper sanitation of the area would be applying antimicrobial soap and water to the area. Being an experienced doctor, this was completely out of the norm for him to ignore something so severe. Dr. Woodruff was worried his illness was something worse than the common cold, so he went to the hospital to receive a proper diagnosis. At the hospital, Dr. Woodruff had explained how he had been back in the United States for about a week, so he was unsure if he caught something in Zaire or not. The two doctors decided a gram test of his blood would be the appropriate course of action, as neither of them had any idea what the illness was. The gram test would determine if bacteria were the culprit for his illness, as viruses do not appear in the gram test. A gram test functions by staining the peptidoglycan layer of a bacteria's capsule purple if it is gram-positive or red if it is gram-negative. Upon finding no signs of bacteria within Dr. Woodruff's blood, the next course of action was to call for a PCR test. The two doctors knew that if they wanted to determine the cause of the doctor's symptoms, they would need to use this test. The PCR test is a polymerase chain reaction test that uses a DNA or RNA primer to bind to parts of a foreign microbe's genome. It is useful in diagnosing viruses within people. After receiving the results of the test, Dr. Woodruff was shocked to see that his infection was due to a virus called the Ebolavirus, more specifically, the Zaire Ebolavirus. Now, before we discuss treatment, what exactly is the Ebolavirus? Ebolavirus is a highly contagious, true pathogen with high case fatality rates, reaching up to 90%. Ebolavirus is a negative-sense, single-stranded RNA virus in the family Filoviridae. The virus was first discovered in 1976 in the Ebola River Valley of Zaire. The outstanding virulence factor of this virus is that Ebola actively subverts both innate and adaptive immune responses and triggers harmful inflammatory responses as it inflicts direct tissue damage. The transmission is mainly from infected fruit bats, but also can be transmitted through direct contact with an infected host body fluid. Like I had mentioned in Dr. Woodruff's case study, common symptoms include a high fever, muscle aches and pains, fatigue, a sore throat, a loss of appetite, and diarrhea. Ebola can be diagnosed using a PCR test or an ELISA test. Since Ebola is an RNA virus, there are few options to diagnose this illness. The treatment for Ebola virus is sparse, but there are two treatments that have seemed to provide high recovery rates for individuals affected by Zaire Ebola virus. The first treatment is called Inmazeb. It is a combination of 3 monoclonal antibodies. Monoclonal antibodies are antibodies created in a lab that function the same way normal antibodies function. They mark foreign microbes or infected host cells for phagocytosis by macrophages. Another form of treatment for Ebola would be Ibanga. Ibanga is a single monoclonal antibody treatment. Both treatments are only effective against Zaire Ebola virus. However, they boast a high survival rate. After taking Inmazeb, Dr. Woodruff was able to make a full recovery after just 2 weeks. This case is an optimistic one, as most people infected with this virus are not so lucky to receive the same outcome. Whether it is lack of healthcare or worse living conditions, most people with Ebola virus in third world countries like Zaire have a much lower chance of survival. Ebola is a deadly virus that cannot be taken lightly. Since there is no vaccine for the virus, the chance of another outbreak similar to the one in 2015 is very possible.